Hello, welcome everyone to Serving Breakfast After the Bell and its impact on chronic absenteeism. We are so pleased that you are joining us today. This is a 60-minute webinar. We have a lot of exciting things to bring you today. Just a few housekeeping notes before we begin. This webinar is being recorded, so you will be able to access this at a later date. And in case during the webinar you have any questions, you are able to communicate that to us, the speakers and panelists. If you scroll on your screen to the very bottom, you should see a little icon that says Q&A. That is the chat box. Feel free to type, or excuse me, that is the question box. Feel free to type in questions at any point in time during the webinar. We've allotted a good amount of time to answer those questions that you send to us, so please type them in. We look forward to hearing your thoughts. With that, let's go ahead and begin. Next slide, please. All right. I'd like to introduce today's speakers. I am Summer Kriegshauser. I'm a senior manager of school breakfast at Share Our Strength. And I will talk a little bit about who we are, Share Our Strength. But we also have Hetty Chang. Hetty Chang is the executive director of Attendance Works, which is a national and state level initiative aimed at advancing student success by addressing chronic absence. Hetty has spent more than 2 decades working in the field of family support, family economic success, education, and child development. She was also recognized by the White House in 2013 for her work as a champion for change on education. So we are happy to have her. We also have Karen Wong. Karen is the Senior Manager of Research and Evaluation for Share Our Strength. She has experience leveraging research, evaluation, and policy analysis to address economic and health inequalities. And she has a background in public health as well. Welcome, Karen. And finally, we have Julie Pittman. Julie is the North Carolina No Kid Hungry Educator Outreach Manager. She was the 2018 North Carolina Western Region Teacher of the Year and has been an educator for 22 years. So we are also very pleased to have Julie on the line. Next slide, please. All right, so this is how we will be spending the next hour. Like I said, I will be talking a little bit about Share Our Strength and just give a little bit of information about breakfast after the bell, really level setting there. Then we will dive into chronic absenteeism, talk a little bit about that. That will be Hetty. Karen will talk about research on breakfast after the bell and its impact on chronic absenteeism. And then Julie will be talking about her educator perspective about breakfast as an education issue. And then, like I said, we will have a lot of time for questions at the end and discussion. Next slide. So we can actually go to the next slide here. All right, a little bit about No Kid Hungry. No Kid Hungry is a campaign of Share Our Strength. We work to increase access to the school meals programs, specifically school breakfast, after school meals, and summer meals. We believe in building upon the infrastructure that already exists. So we have sort of a 3-pronged approach to doing that. We feed kids, we work with schools and communities. We also teach families through our Cooking Matters program about how to take healthy food and incorporate it into their daily lives. And then we also work with elected officials and leaders in the public sphere to move the needle on ending childhood hunger in the policy world. Next slide, please. Let's dive into why breakfast is important. There are many things to note, but we know that hunger is an issue. And we know from research that 3 out of 4 public school teachers say that students regularly come to school hungry. That means students may not be getting their daily needs met. And our speakers will talk more about this later on in the webinar, but that can have a big impact on academic outcomes. It can have an impact on health. We know that hungry children are sick more more often. And then big picture, it can have an impact on the economy where hunger's cost is enormous. That can start just from that very small classroom activity to the bigger economic impact. Next slide, please. So let's dive into traditional cafeteria breakfast. We know that traditional cafeteria breakfast, and this is where breakfast is served in the classroom, or excuse me, in the cafeteria before the school day starts, has some challenges. We know that cafeteria breakfast can meet the needs of some students, but not all students. And so this slide illuminates why cafeteria breakfast may not be the right fit for all students. We know that students might not have time for breakfast in the morning before the school day starts due to factors that they have no control of, including the bus or carpool schedule. We know that there's a stigma associated with having breakfast before the school day starts, specifically for low-income students. So we see students, in fact, skipping breakfast. We also know that middle and high school students have a different hunger pattern. Their hunger may come on later in the morning. And so the prospect of serving breakfast even before the school day starts is not appealing at all to middle and high school students, so they skip that breakfast offering. Depending on the location of the cafeteria in the school, it may not be convenient. Students may not have time to go to the cafeteria and actually eat breakfast before they go to their first period class. And we also know that students, sometimes they would just rather socialize with their friends. We see this a lot where if the option is to go socialize with friends in the morning or go eat in the school cafeteria alone before the school day starts, oftentimes the socializing wins. So we know how to meet the needs of more students, and that is by making breakfast a part of the school day, just like lunch. Making breakfast a part of the school day addresses those common barriers that I just listed and really ensures that more students are starting their day with a healthy breakfast so they can be focused, so they can learn, and so they can be healthy. 3 specific models are the most common in making breakfast a part of the school day, and those are the breakfast after the bell models. This is breakfast in the classroom, grab and go to the classroom, and second chance breakfast. And I'm going to dive in just a little bit deeper about the basics of these models. First, I want to show you the participation rates, though, in that these models really do meet the needs of students better than traditional cafeteria breakfast. These numbers show the participation of the free and reduced lunch eaters who then also eat breakfast with these models. As you can see, breakfast in the classroom, where breakfast is offered and served in the classroom, has a participation rate of 88%, grab and go, 59%, and second chance breakfast, 58%. And again, I'm gonna dive in a little bit deeper into the specifics of these models. Next slide. So breakfast in the classroom. I showcase breakfast in the classroom in 4 steps. Breakfast in the classroom is exactly what it sounds like. It is served in the classroom and eaten in the classroom. The process usually takes 15 minutes. That includes cleanup time. As you can see, step 1, breakfast is prepared in the cafeteria and it's put into the serving vessel, or excuse me, the transportation vessels that will then take it to the classroom. Step number 2, the breakfast makes its way to the classroom. We love student participation here because that increases student buy-in. Step number 3, students take their reimbursable meal. And step number 4, clean up. And as you can see, there's a cooler that will need to be taken back to the classroom. Next slide. Grab and go. So this is where breakfast is served from 1 or more central locations. And I outlined it here in 4 easy steps, as you can see. Step 1 is getting that cart ready to go. Step 2, students grab their reimbursable meal. Step 3, the participation is recorded. And step 4, there's cleanup. We're going to move straight to the next slide to talk about second chance breakfast. So this is where breakfast is served a little bit later in the morning, often between first and second periods. This is great for those middle and high school students who just aren't hungry first thing in the morning. This gives them another opportunity to eat when their hunger actually comes on. So this is a highly successful model in middle and high schools. And we see this executed in usually two ways: grab and go, the way I described earlier, or we see schools open up the cafeteria and allow 15 minutes for students to eat. Next slide. All right, so that wraps up the basics of breakfast after the bell. I'm going to pass it along to our next speaker, Hetty Chang.
Great, thank you so much. Let's go to the next slide. So, the overall point of this webinar is in part to share this great new research that shows that breakfast after the bell can have an impact on chronic absence. And what we thought is that it would be really helpful for you to understand why that matters so much. So next slide. First of all, I want to make sure that everyone knows what we mean by chronic absence. Chronic absence is actually a relatively new education metric. It's missing so much school for any reason that a student is academically at risk. And by and large, most states and most researchers have defined it as missing 10% or more of school for any reason. That includes excused absences, unexcused absences, suspensions. When that adds up to 10% or more the school year, or just 2 days a month, that actually is called chronic absence. And that's different from truancy, which is just unexcused absences, and the way that we've typically looked at when kids don't show up to school, or average daily attendance, which is how many kids show up to school each day, which is used in some states and places for funding purposes. Next slide. The reason why it's really important to look at chronic absence is because what we find is that this is kind of the, if you will, research, common sense research. There's a real connection between attendance and academic success. Starting as early as pre-K, K, and first, kids who show up regularly in the early grades are more likely to be reading at the end of third grade. By the time you get to middle school, chronic absence is associated with not passing your middle school classes. But on the other hand, if you show up a lot, you are likely to be showing up to passing your middle school classes. High school, this is key to high school completion and college completion. And when you have chronic absence, it's a real warning sign that you are at risk and off track for these desired educational outcomes. Next slide, please. This is also extremely important for the most vulnerable kids, who are more likely to exhibit chronic absence at an earlier age because they're more likely to experience the challenges: unstable housing, poor transportation, lack of access to healthcare, food insecurity. And those are likely to be challenges that may repeat more than 1 year, and more than 1 year chronic absence is really a huge challenge for academic outcomes. And those kids are also, when they're low income and don't have so much resources, least likely to have the resources to make up for the time on task in the classroom. Next slide, please. What we know is this is a very widespread challenge. Nearly 8 million kids in the United States are chronically absent, and more than half of those chronically absent students are found in 4% of the districts nationwide. It's very concentrated. And at the same time, while urban and suburban districts typically have the larger numbers of chronically absent kids, rural districts often have very high percentages of chronic absence due to some of the challenging issues of access to transportation and healthcare that occurs in rural areas. You can actually go to this map here. This is from the 15-16 data, which is the currently available national data, and you can click on your state, your community, and figure out how much chronic absence is a challenge in your community if you don't know that data now. Next slide. Because we know that chronic absence is so connected to academic outcomes, and it is a data point that is relatively easy to obtain, it has been adopted really now as this new education metric. It means that all states actually have to report on chronic absence, and over 70% of states included chronic absence as an accountability metric in their ESSA plans. And most of those states defined it as missing 10% or more of school days. Next slide, please. This means chronic absence data is incredibly valuable. Again, when I started this work 10 years ago, no one even knew this was a term. No one even knew they should be calculating it. We know that truancy and average daily attendance, they actually mask high levels of chronic absence, But now we have chronic absence data available everywhere through like the map that I showed that's based on OCR data. Soon, we hope to get even more updated data through EdFacts. Most states, I live in California, and in California, you can go on to the California Department of Education, look up at DataQuest, and you can get chronic absence data for any district, any school, any county in the entire state. There are more and more states that that is true for. And increasingly, school districts are producing this in real time, which is really important because it means at the end of the first month or the second month or the first semester of school, you know which kids are chronically absent, so you know who really needs extra supports. And this makes this data more frequently available than most other kinds of measures of emotional health or academic performance. Next slide, please. So the thing that's really important is chronic absence is a problem we can reduce. Next slide. It means that we have to shift from just thinking about poor attendance as truancy or unexcused absences, which really kind of goes to compliance with school rules and tends to focus on legal solutions. And sometimes it's more blaming. Often our truancy notifications, for example, threaten families with your kid didn't come to school and we're threatening you with taking you to court. And we actually know that chronic absence is associated with higher levels of trauma. Chronic absence is an early warning sign that something challenging is happening in the life of a kid and a family. And when we think about all absences, because we know even when you have excused absences, which can occur when kids, for example, say they're sick and families turn in saying kids are sick, those excused combined with unexcused absences can really cause kids to fall off track. And when that's happening, it means we need to take a problem-solving, trauma-sensitive approach. Because if kids are faced with challenge, the worst thing you can do is blame them. That doesn't engage them. The most important thing to do is say, what's going on and how can I help you? And that's about family and student engagement. Next slide, please. Next slide, please. Yep. We know that if you want to resolve chronic absence, you have to understand what are the challenges that get in the way of kids coming to school. Is it barriers? And food insecurity is a kind of barrier, right? At the same time, is it negative school experiences? Because they don't feel welcomed in the school. And if you think about breakfast in the classroom, where some adult welcomes you in the classroom with a warm bowl of food, that's actually countering negative school experiences. It helps kids feel like they should be part of the classroom while possibly addressing a barrier. This is about making sure that we understand what are the kinds of challenges kids face and then putting in place supports that help them overcome barriers in the classroom, overcome negative school experience, feel a sense of engagement in their school, and make sure that we are also addressing the misconception that maybe attendance doesn't really matter when it does matter, and just missing 2 days a month of school can lead kids to be off track. And when you have high and extreme levels of chronic absence, as you often do in schools faced with high levels of poverty, it means that we really have to have an additional investment. And that's the kind of investment that having breakfast after the bell lunch program represents, especially if you know food insecurity is an issue. Next slide. This is about making sure that the positive conditions of learning are in place. And when you have high levels, again, it means they may not be, that kids may not be feeling physically and emotionally healthy and safe. They don't feel that sense of belonging, connection, support. They may not be feeling academically challenged and engaged, and they may not be surrounded by adults and students. But again, if you think about a strategy like breakfast in the classroom, which promotes physical health, when you put it in a warm, engaging classroom setting where adults and other kids are around them, that extra 15 minutes between period 1 and 2 that makes them feel a sense of connection. When you make sure kids aren't hungry so that when they're learning their lessons, they're engaged in following what's going on, you're actually putting in place these kinds of conditions for learning. Next slide. It's really about putting in place a prevention-oriented kind of public health model. And breakfast after the bell is part of that kind of tier 1 supports, which helps kids feel engaged by their school, positive relationships, making sure that a common barrier, food insecurity, is addressed. Now, you might sometimes need use chronic absence data to make sure a kid benefits from that. Let's say you see a kid is chronically absent and you make sure they're coming in early so they get the access, that they're actually getting their free meal when they come into their classroom. And that's where you can combine sort of tier 1, making sure the program's available, with additional outreach for tier 2 or tier 3 to make sure all kids, particularly those most at risk, get those kinds of supports that you need. Next slide, please. We know that health-related causes or barriers are major causes of chronic absence. And nutrition is one of those key both causes and solutions that we can be addressing. So with that, I'm going to turn it back to the folks over at Share Our Strength to keep talking about how this all works.
Great, thanks Hetty. This is Karen with the No Kid Hungry campaign, and I'm here to share with you all today some exciting new research that highlights the connection between breakfast after the bell and chronic absenteeism. So in 2019, the No Kid Hungry campaign commissioned research to explore whether expanding access to school breakfast by serving breakfast after the bell can help reduce chronic absenteeism. We were lucky to be able to work with leading education researchers with the University of California, Santa Barbara, Dr. Gottfried and Dr. Kirksey. We wanted to explore this question through rigorous research that leveraged quantitative data. And so the study consisted of 2 analyses, one at the state level and another at the national level. I will very quickly share about the research methods in the next 2 slides before talking about the results. So first, with the state level analysis, we looked specifically at Colorado and Nevada. For context, both of those states had passed legislation requiring high poverty schools to serve breakfast after the bell. So essentially, schools were required to serve breakfast after the bell if 70% or more of their students qualified for free or reduced price meals. In this analysis, we looked at chronic absenteeism rates before and after the legislation, comparing schools that were newly serving breakfast after the bell to schools that didn't have this change. And the researchers used econometric methods to conduct the analysis. We're able to look at schools of all grade levels, so that included elementary, middle, and high school. And we're also able to look at a variety of breakfast after the bell models, including breakfast in the classroom and grab and go. Although by and large, most of the schools were implementing breakfast in the classroom. The data that we used was pulled from the US Department of Education Civil Rights Data Collection, which Hetty referred to earlier. And the data on breakfast after the bell was from the Colorado Department of Education and the Nevada Department of Agriculture. Next, just wanted to talk quickly about the national level analysis and the methodology used there. So the national level analysis looked at the impact specifically of breakfast in the classroom on young elementary school students. So the national analysis was broader than the state level analysis in terms of geography, but it was a little more narrow in that we were able to look only at kindergartners and first graders and specifically at breakfast in the classroom. So for the national analysis, we used nationally representative data from an existing survey called the Early Childhood Longitudinal Survey. That survey had information not only on chronic absenteeism rates, but also other student outcomes like test scores and social emotional development. The data was focused on kindergartners and first graders, and we had information on whether or not between the 2 years, those students experienced changes in whether or not their school offered breakfast in the classroom. So we were able to look at chronic absenteeism and other outcomes for students when their school newly started offering breakfast in the classroom and compared them to students that didn't have a change in access to breakfast in the classroom. And again, in this analysis, the researchers use econometric methods to look at this question. So what are the results of the study? For the state analysis, we found that chronic absenteeism rates were on average 6 percentage points lower for schools that were serving breakfast after the bell. So for context, if a school was starting with a 22% chronic absenteeism rate, that would mean on average they were potentially seeing their chronic absenteeism drop to 16%. When we looked at specific types of schools and looked at whether or not certain schools benefited more, we saw that breakfast after the bell was particularly helpful in reducing chronic absenteeism in elementary schools and rural schools, which is particularly important, as Hetty mentioned, because chronic absenteeism rates can be quite high in rural schools. So for the national analysis, we similarly saw that chronic absenteeism rates did also drop for schools that serve breakfast in the classroom. And in this national analysis, we were able to look at test scores and social emotional development. We didn't have that data in the state analysis. And in the national analysis, we found that breakfast in the classroom was related to improved reading test scores, and it also had the potential to improve social emotional development. For example, teachers were asked questions about whether or not their students exhibited anxiety, loneliness, low self-esteem, and sadness. And they found that students who had breakfast in the classroom had improvements in those behaviors. So we were very excited to see these results, as it's the first known evaluation of breakfast after the bell that looked at both national data and state level data. And it was really important that the results held up across multiple contexts, which is really showing that these findings are robust. And on top of that, this is really contributing to the evidence base showing that school breakfast can be a tool that can help chronic absenteeism. And although some folks might think that school breakfast is not related to school success, this is really showing that it's very much intertwined with how well students can do in school. So as educators, community leaders, and policymakers are looking for ways to meet basic needs and address chronic absenteeism, serving breakfast after the bell does stand out as a research-tested approach. So with that, I will hand it over to Julie Pittman. I'm really excited to have her share her experiences as an educator.
Hi, thank you. I'm also excited to talk about the way that I've been able to see breakfast as part of the instructional day really transform the lives of my students and students across the state of North Carolina. Maybe go to the next slide, please. When I first started seeing breakfast as an issue in my school, I was noticing, and this was about 7 years ago, I was noticing in my high school classes that we were having a growing number of students who had an absenteeism issue, either were tardy to school or were not coming to school at all. We live in a rural, high poverty area in North Carolina. And I would notice occasionally when I was walking around my classroom, students who had food that they had taken from the cafeteria and were putting them in their backpacks and eating throughout the day, or even taking it home with them in the afternoons. And at that time, behavior issues in class were super high, and success and outcomes for students was not high at all. And so when we started having breakfast after the bell, and we had a second chance breakfast, more of my students were coming to school on time and staying the full day. Our behavior issues went down. Our success rates went up. In fact, our district should not be outpacing or outperforming our state metrics, given the statistics of the type of students and their socioeconomic backgrounds and incidents of trauma. But over the last 7 years, we've seen a significant rate where we are now not only outperforming several metrics across the state, but outpacing the state and several like counties and districts across our state. And I attribute this to several things, but the majority factor for this is breakfast as part of the instructional day. So I love talking about Maslow's hierarchy of needs, because oftentimes as an educator, my top level of Maslow's, that self-actualization, that's my job description as an educator. I'm required to help my students become who they were born to be, help them be successful on state metrics, help them to be successful on standardized tests, grow them into citizens who are going to be contributing factors in our communities. But I can't get to that top level if the bottom level of physiological needs are not met. And that's where food and food insecurity falls. If we're not addressing trauma and safety and nutrition and food insecurity by making sure that we're feeding our kids in our school systems, then we are essentially putting a roof on a house that has no foundation, and it will fall. We cannot get our kids where they need to be if we're not meeting their base level needs. And to just give you a sense of how I think this looks, and why this is important. Oftentimes I hear educators who say they don't want to have breakfast in the classroom or in the hallway because there's a huge mess. And I say that when there's trash in the hallway, that's not a breakfast issue. That's a management issue. And we as adults need to help our students learn all types of lessons, not just reading, writing, and arithmetic, and all the other contents that go into teaching our students. We have to teach them to clean up after themselves and to make sure that they're taking care of themselves and being kind to one another. These are all things that we're charged to do as educators. And the second thing that I hear often from teachers and educators is that breakfast as part of the instructional day means that there's instructional time that is abandoned in order to feed students breakfast after the bell. That also is not the case. There's a school in Brunswick County, North Carolina, Lincoln Elementary School, and the third grade teachers noticed that, like a lot of elementary school teachers or a lot of elementary schools, kids report to either the gym or the cafeteria before the school day starts, and they wait there until they're brought to the classroom. And pre-K through 8th grade was in the cafeteria, and it was overcrowded. And the third grade teachers, given that that's where most of their the state mandated tests fall in third grade, said they were going to do something about that. Said they worked with their school nutrition director and cafeteria manager and brought breakfast in the classroom. So those students don't report to the cafeteria, they report to the classroom. They have breakfast at their desks. This is a one-to-one school system with Chromebooks at every desk. And so the kids are having their Chromebooks out, their morning work is on the Promethean board at the front of the classroom, and their breakfast, they go and get their breakfast from a common table in the classroom and eat it at their desks. Zero reported incidents of computer problems, of spilling milk or crumbs on the computers. And those teachers have gained an additional 20 to 30 minutes of instructional time with all of their students in the third grade. So from the beginning of the year when they were benchmarked to the middle of the year when they had their second benchmark, those kids' scores went out the roof. And the teachers say, I don't know if it's because they got 20 extra minutes or because we're feeding them breakfast. I say it's both. When students believe that we believe in them and that we are making sure that we are feeding them and that we're caring for them, and we know that we're trying to eliminate barriers and engaging them and giving them a positive experience from the beginning of the day to the end, those kids will walk through a wall for us. They will do things that they are not, they don't even believe that they can do themselves, but they do it because they know that their educators believe in them. I think I have one more slide, or maybe not. Yeah, well, I firmly believe that breakfast after the bell is not just meeting the physical needs of our students. It's not just helping them know that they're going to get to school physically. They're also going to come mentally prepared. They're going to come emotionally ready to learn, and they're going to be better off in the future because they know we're meeting every single one of their needs. So I'm going to kick it back to Summer, I believe, who's going to lead us in a time of Q&A.
Julie, this
Yes.
has been amazing information presented. We have been getting such great comments in the chat box about the power of this research and this information, and we feel just as passionate as you all, so we're so excited to hear those kind of comments. We do have some questions that have come in. Feel free to keep sending those our way through that Q&A box, through that question box. I'm going to read off the questions that we have thus far. This first one, I believe, Julie, this one is for you. It says, were there other programs or changes that were implemented at the same time when you talked about, the changes of breakfast after the bell that may have contributed to an impact in positive outcomes and chronic absenteeism? So Julie, do you want to answer that?
Sure. In my particular school, that we implemented, in my school district, we implemented innovative breakfast programs around the same time that we also went to a one-to-one. So all of our students had a device in front of them during the day. And there were lots of challenges with that, but really the challenges, or really the successes of those two things, came hand in hand. We were trying to eliminate barriers for our students who are in rural North Carolina to not only know that their education was limitless, but that their possibility and our belief in them was also limitless. So they were getting lots of support. But what I actually noticed during that time in terms of nutrition, and I'm an English teacher, so school nutrition is, outside of the fact that I know what it's like to be hungry as a kid, and I know what it's like to have hungry kids in your classroom, and I'm passionate about this, school nutrition is kind of outside of my wheelhouse. But I do know this: when our kids would come in and they grabbed a breakfast at Second Chance Breakfast, regardless of their socioeconomic background, and we were all eating together in the classroom, our kids were super engaged, and in a way that they had not been. And I'll give you another example. I have twin 10-year-old daughters who are in the 5th grade. Their 3rd grade teacher had breakfast in the classroom. Their whole elementary school did, but she gave them something that was really important. And that's something that a lot of families, regardless of their socioeconomic background, don't have right now, and that's family meal. It's a pastime I grew up with, but a lot of families either don't have time or don't have means to have that. And like our family is super busy. We don't get home until almost 8 o'clock at night because everybody's got activities. But a lot of times families, they don't have family meals because they don't have meals. And so for our daughter's 3rd grade teacher to offer them a family meal around a shared table where she was checking in on them and giving them extra support, and they were learning manners, and they were learning how to read nutritional labels, and they were making nutritional choices based off of what was given to them in their classroom. That is an experience that my children were able to have that I was not able to offer them. And it's an experience that's invaluable for them to know that they can socialize in a way that is important at that age and at every age. And so many lessons came for our students when we started offering breakfast as part of the instructional day.
Summer, this is Heidi. I wanted to just offer up that the research on chronic absence is that it's not just one intervention that makes a difference. And especially when you have high levels of chronic absence, it's the more interventions that you have in place that build off and leverage each other that make a difference. And while I do think it is helpful when we can identify through something like this research that, a particular kind of intervention appears to have an impact, I also think it's really important for us to think about what's the kind of system of supports. When you want to have that prevention-oriented approach, there's multiple things that go into a positive tier 1, and that's what I'm hearing Julie describe. And so as people think about what they want to add in, if they know food insecurity is one of the issues, as well as strong relationships to teachers with their kids or building connectedness among their kids would be of value, then I think creating this kind of using meals, which are such an important part of relationship building, to both meet nutritional needs and meet relationship building needs, then makes sense as an intervention.
Great. Thank you, Julie and Hetty. Next question, and this is a quick one. I can answer this. It asks, the person is asking, is there a way to share this webinar with all administrators? We would love for you to share this with all administrators. No Kid Hungry will be sending out the recorded webinar with a link, so you can disperse that however you'd like to. No Kid Hungry will have this webinar on our website, and Attendance Works will have it as well.
And I also want to add that we are having a webinar with the National Association of Elementary School Principals on Thursday as well. So if anyone wants to join that to be able to participate in Q&A, they're also welcome to join that webinar on Thursday. And I think that link did get sent out in the chat box too.
Great. Thank you, Karen. All right, I'm going to read the next question. This attendee says, our district is getting some pushback from parents and city leaders about the quality of the breakfasts that are being served in the classroom. How are other districts addressing the issue of high sugar content in the majority of quote unquote convenient breakfast options? Are other districts successfully serving hot breakfast like eggs in the classroom? So I can answer this. We actually, No Kid Hungry has resources on this because food quality can also be a barrier to students participating in the school breakfast, for parent buy-in, for teacher buy-in, for principal buy-in. And what a lot of folks don't know is that school breakfast is actually quite healthy. In order to even be served and be part of a reimbursable meal, meaning districts get federal reimbursement for the number of breakfasts they serve, they have to meet rigorous USDA guidelines. So let's say you see a breakfast item in the corner store, even though the same packaging may be in the school system, the nutritional content is vastly different. And as part of our follow-up, I will send you and link out to those resources. One is called School Breakfast is Healthier Than You Think. So part of the promotion for Breakfast After the Bell is really helping folks understand how healthy school breakfast really is. Next question. Someone wants to know, do you have additional data on the high school level? And I'm going to ping that over to Karen to take that.
So as part of the analysis in the two states, Colorado and Nevada, we did include high schools, and that was included in the data on elementary, middle, and high schools. We just weren't able to look specifically at high school alone. So we don't have specific data on high schools specifically, but they were part of the study.
Thanks, Karen. Another question is, for the breakfast after the bell, do teachers individually provide and pay for the breakfast, or would that come out of the school budget for all classes? So I think what the question is asking is, well, actually two things. It could be if teachers are eating, do they individually pay for their breakfast? That's my first interpretation of this question. I think the other interpretation could be, does it come out of the school budget? So I can also answer that. So school meals has a completely different budget than the district general fund and the individual school budgets. So the school meals are part of the school nutrition budget. That means the school nutrition budget, essentially school meals are kind of like a business. They have to operate like a nonprofit. That means the revenue that they take in, they have to reinvest into the program. So the higher the participation of school meals, the more students that eat these school meals means the more money that the school nutrition department has to reinvest in the program. So that means more options for meals, perhaps more staff, the ability to purchase different equipment. And so really when students participate in the school breakfast program, you're also investing into the school nutrition department, but then the bigger picture of the whole school district, because as you can see, when students eat school breakfast, the outcomes are well beyond just filling a hungry belly. The outcomes are improved attendance, more focused students. Like Julie was saying, there's a community feel, a family meal. So there's lots of wonderful outcomes that come out of this. Would any of the speakers like to add? Okay, I think, I hope I made that clear that the school meals is paid out of the school nutrition budget and not out of the district general fund. Okay, next question. Someone asks, have they surveyed the students about the impact of the breakfast chafe? Maybe that's a typo there. And this same person is asking, are there hot or cold options? I can answer this again. There are absolutely hot and cold options. A lot of times we see schools, school cafeterias rotate between hot and cold items. This helps with student buy-in. This helps keep things fresh for school breakfast. And generally we see often a rotation of menu items, and that can be most pleasing to students, both hot and cold items. Next question, what kind of timeline did this take from conversations with the district level teams to nutrition services to building administrators? And they also asked, did you use any grant funds to support the acquisition of the needed thermal bags and other logistical materials? So Julie, I'm gonna send this over to you on how long the whole process took from soup to nuts.
Yeah, I think that depends on, it probably depends district to district. We have, I know that I've worked with several districts whose school nutrition director and superintendent work closely with the school board and the district office to look at data and begin to have those conversations over the course of a year, and then to begin to build out a plan, apply for appropriate grants as needed, and then purchase materials, train teachers. I've seen it happen anywhere from a full year of planning and implementation at the end of the year or the beginning of the next, to a school that I worked with this past summer, and from soup to nuts it took about 5 weeks. So but that was an all-in. Everybody was already doing so much to really support the needs of the students. Again, I think it depends on the size of the school, the climate of the school culture, and you know, if it's a district-wide or a school level buy-in. I would like to go back to a question that was part of that previous question. Had we surveyed students? And I have done some student surveys here in North Carolina, and I know we have a group with No Kid Hungry, the national team that does some student surveys, and especially in a couple of districts that I worked with, the students completely know when they have peers, and this is middle school and high school, but even my own daughters have talked about this in elementary school. Students know when they have peers who are hungry. They know when they have peers who have needs that are not being met at home. And they also know when their peers are hiding things that they don't want everybody to know. Students are very in tune with each other, and they often don't talk about it out loud with adults, but they definitely know. And so when the students that I've worked with and we've surveyed have looked at how breakfast has been implemented and what it does to help their peers, they're so compassionate and so wonderful to give feedback and to make sure that their friends are eating. And I know there's a lot about stigma in the classroom or stigma in the cafeteria, but students know, and the feedback that I've gotten has been really amazing to see how compassionate students are, and their willingness to give feedback on food quality or food choices, or how food is distributed, or where the food carts are if it's a second chance breakfast. So just some powerful stories that are coming from students who know that they have peers who are hungry and peers who are in need, and that the schools are really doing things to meet those needs, and that they're excited to have a voice in helping to do that.
Thanks so much, Julie. All right, next question. The question reads, the high schools who offer breakfast during the day, did they share their class schedule on how they do this logistically? So I can start this and then maybe I'll pass it off to you, Julie. But really this can be done in a lot of different ways. There's not a one size fits all formula for this. Like I showed earlier in the webinar, a very popular model for high schoolers is that second chance breakfast where it's served mid-morning or between first and second period. So you really are capturing those students and when their hunger patterns emerge. So if you do a grab and go, you can absolutely set up the grab and go carts in the hallways that are highly trafficked because you're going to know the traffic patterns. That's what's going to be part of this prep. Like Julie was saying, I think she said sometimes it can take up to a year just for planning, for stakeholder buy-in. And I also want to note, please make sure you involve your school nutrition director. They are the ones that are going to be really running the show and executing these programs. So it's very important to talk with them, to touch base with them. So back to the grab and go, if there's enough time in between classes, you can easily set up a grab and go, a few carts in those heavily trafficked hallways, and students naturally will need to go to their next class when that bell rings. So they travel through the path where the cart is anyway. And you can go through those lines pretty quickly. We see some schools that are, in under 3 minutes getting 100 students through those lines because they figured out how to do it really efficiently. We've also seen schools, like I said, if they want to reopen the cafeteria, that's a longer planning process where maybe it doesn't happen immediately, but they restructure the schedule. So next semester or even the following school year, they implement that. There are lots of ways to do it and lots of ways to play around the schedule. This is why it's very important to have multiple stakeholders as part of the planning process so you can get a lot of different perspectives to see what would work best. And so you're not leaving out the custodians or certain teachers or even para-educators. Everybody needs to be on board to make this a success. Julie, do you want to add anything to that?
Sure. I think just really briefly, it can look very different. I'm working with a district right now who's doing grab and go to the classroom at the entryways where all students come in, either at parent drop off, student parking, and the bus drop off. So they've adjusted their tardy bell so that if kids are in line because the bus was coming through and they're taking their breakfast to the classroom, their tardy policy has been changed. My personal high school, we added a minute to a class change, I believe, so that there were maybe 6 minutes instead of 5. I've seen it work, 10 minutes instead of 7. And you can get through 100 kids in a cart if you've got a really well-structured team working the cart or the grab and go area. I think it is site by site determined, and to work with the administration, get feedback from stakeholders including students and teachers, and not only the school nutrition director and the school nutrition manager at the site, but also the custodial staff, because they'll need to be a part of that program to make sure that all systems around meals that are non-traditionally served are working efficiently together.
Thanks, Julie. I have a question for Hetty. Hetty, the question reads, is there a database with chronic absenteeism rates? Specifically in California, this person would like to know how their school is performing compared to other schools in the district.
Yeah. Can you hear me? I'm making sure that I managed to.
Yep, we can hear you.
Great. If you go onto you can actually just Google DataQuest, DATAQUEST, and California Department of Education. And that will give you end of the year data that is, you can search by school district, county office of county, and school. and you can look under absenteeism. It actually gives you all sorts of other mechanisms, or other metrics actually. And it is easy for you to find what is the chronic absence levels, and you can actually disaggregate that by, see it by race, ethnicity. You can look at it by grade bands. So California has an extremely robust data system, and DataQuest has chronic absence rates for elementary through high school. If you are in California, there's a California data dashboard, but we only have K-8 accountability in California, so it's not quite as inclusive. And if you're in other states, you should look at your own state department to see whether they have that kind of chronic absence data. I think I saw Chrissy Johnson with Washington Department of Education on the chat. Washington Department of Education also has chronic absence in it. Connecticut has a really robust system. So wherever you are, you should look up your state Department of Ed and chronic absence, and you can actually probably use Google just to figure out where that is. I also had a question, Emily, if you might, because I saw this question coming up about what happens when you have not so many kids on free and reduced price lunch, so maybe don't qualify as much for government resources to fund this. I'm wondering, this is a question to share our strength, are there any models where people have combined public dollars with, let's say, churches or other resources so that you can serve all kids and not just the kids who might qualify for free and reduced price lunch? I also ask this because I do have some concerns about immigrant communities who may, because of the public charge rulings, be worried unduly that signing up for free and reduced price lunch might disqualify them from legalization. And this notion of having access to more nutrition programs without having to apply for government subsidy could be a real benefit in many places. And just wondering what's your experience in commingling funds and making sure that kids don't actually have to submit applications.
Thanks for your question, Hetty. This is Emily from Share Our Strength as well. So there were a couple parts of that question that I think I can answer a little bit differently. So the question that came into the chat box for context was around schools that have a low free and reduced priced student population and which breakfast after the bell model might work in those schools. We recommend that where you might have a low free and reduced student population, you might consider grab and go breakfast in the hallways. So you're putting carts out in the hallways in areas where students already congregate to make it more accessible, rather than really making it a part of the classroom institutional time. That might make it more accessible and reduce the stigma for students who are eligible for a free and reduced price lunch without creating the norm that kind of every student eats breakfast if that's not going to be the culture that works well in your school. To answer kind of more of what you were asking, Hetty, as it relates to offering breakfast and lunch to all students, there are federal funding options for the National School Lunch and Breakfast Program, namely the Community Eligibility Provision and Provision 2, which are two separate funding options, and we have resources on those that we can share, which allow schools to offer breakfast and lunch for free to all students, but those are only for schools that qualify, so only those schools that have a high eligibility threshold, so 40% or more of the students in those schools qualify for free lunch for CEP specifically, Community Eligibility Provision. For those schools that don't meet those thresholds, you can find private funding from churches, from community members or other groups. However, we don't necessarily recommend that because it's not as sustainable an option, and you wouldn't want to offer families and students free meals for 1 year and then have that taken away in a later year if the funding isn't there. And so we really recommend working within those federal options and finding the solution that works best for each school.
Great, thank you, Emily. And I'll just add on that, and then we'll close out the webinar because we're basically at time. Someone talked about low free and reduced rate and the options. And one of the questions was, what kind of data do you want to show administrators to get buy-in when you don't necessarily have that high free and reduced? I would say the data points of school nurse visits, discipline issues, because these are indicative of hunger. The free and reduced rate is also not giving the full picture of families that are living on the margins. So there might be families that are paycheck to paycheck, but they don't qualify for free and reduced meals. The other thing is if teachers are already bringing food to the classroom because they know students are hungry, that's a huge flag that students are not getting their basic needs met, and a breakfast after the bell program would be a great solution. So with that, I'm going to close out this webinar. Thank you everyone for attending. Thank you for all the chats in the chat box. We had several people working on it at once because there was so much activity. And thank you for all the folks who typed in questions as well. Like we said, this information will be sent out so you will have access and you can distribute this to your liking. Thank you so much. Take care.